My name is Manali Kamdar. I'm from the University of Colorado Cancer Center. On behalf of my co-authors, I am delighted to present data highlights from the pivotal phase 3 Transform study of Lisocabtagene Maraleucel, or liso-cel, versus standard of care in patients with relapsed or refractory large B-cell lymphoma. Patients whose large B-cell lymphoma is primary refractory, meaning never responded to first-line treatment, or relapse within 12 months, have extremely poor outcomes. For decades, the standard of care in this second-line treatment for large B-cell lymphoma has been salvage immunochemotherapy, followed by high-dose chemotherapy and stem cell transplantation. Unfortunately, though, only a quarter of transplant-intended patients with relapsed or refractory large B-cell lymphoma achieve durable remission with this approach. The pivotal phase 3 Transform study was thus uniquely designed to challenge the current standard of care and address this critical unmet need. Liso-cel, approved in the United States and Japan for third-line plus large B-cell lymphoma, is a CD19-directed chimeric antigen receptor or CAR T-cell therapy product. This is the study design. Transform enrolled patients whose disease was primary refractory or relapse at 12 months or less after first-line treatment and compared liso-cel with standard of care, which consisted of 3 cycles of salvage immunochemotherapy followed by high-dose chemo and stem cell transplant. Patients whose disease failed to respond to standard of care treatment were allowed to cross over to receive liso-cel as third-line treatment. The primary endpoint of this study was event-free survival, or EFS, and key secondary endpoints were complete response rate, progression-free survival, and overall survival. Patients enrolled were high risk, with nearly 75% of patients having primary refractory disease. Of the patients who were randomized to standard of care, only 46% were able to proceed to transplantation. On the other hand, patients that were randomized to receiving liso-cel, 97% of patients were able to successfully receive liso-cel infusion. These are the study results. The study met its primary endpoint with superiority of liso-cel over standard of care. Liso-cel demonstrated a 65% risk reduction of EFS events with a median EFS of 10.1 months compared with 2.3 months in the standard of care arm. A higher percentage of patients achieved a complete response with liso-cel compared with the standard of care, and liso-cel led to a 59% reduction of progression-free survival events. Overall survival data were still immature at the time of this analysis, but shows a trend favoring liso-cel despite a crossover. Liso-cel showed manageable safety profile. There were no new safety signals noted with liso-cel in the second-line setting. Very low incidences of grade 3 CAR T-related toxicities of cytokine release syndrome and neurological events were seen in the liso-cel arm. It is important to highlight that there were no grade 4 or 5 events that were reported. These adverse events were manageable with treatments as per standard practice. To conclude, compared with the standard of care, liso-cel demonstrated a highly statistically significant and clinically meaningful improvements in the following primary and key secondary endpoints. It reduced the risk of EFS events by 65%. It achieved a 27% higher complete response rate, and it reduced the risk of progression-free survival events by 59%. There were no new safety signals observed in the second-line setting, and grade 3 cytokine release syndrome and neurological events were very low. It is important to again highlight that there were no grade 4 or 5 events that were reported on this study. In my opinion, this is a breakthrough therapy, which has shown superiority over standard of care after decades in terms of not just efficacy, but also an extremely favorable safety profile. We are thus extremely excited about the potential of this study to change the existing standard of care in these high-risk patients with large B-cell lymphoma. Thank you.